Emma has a very important job. Emma works for the local health authority in Germany, and all day long, she calls people who came into close contact with someone who tested positive for COVID-19. Today, she's talking with Stefan. She tells Stefan that because he's been in recent contact with his neighbor who tested positive, he needs to quarantine himself for 14 days. Emma asks him if someone is able to deliver groceries to his house for him, and that if not, they can provide that service free of charge. She also tells Stefan that if he starts experiencing symptoms, they'll send a team out to his house to do a COVID-19 test, also free of charge. Emma is a contact tracer, one of thousands across all of Germany. She's a small part of Germany's successful COVID-19 response, which has resulted in not only a relatively lower number of deaths compared to its biggest neighbors, but also faster recovery times and hospitals that were never overwhelmed. To fully understand why Germany was able to successfully contain COVID-19 from the start, we have to go all the way back to January of 2020. By mid-January, there were already warning signs that COVID-19 was going to spread widely beyond China. As a result, a hospital in Berlin quickly developed tests for it and shared the formula online with laboratories across Germany. That meant that by the time the first wave of positive cases came in February, labs across Germany were ready with lots of test kits. This allowed Germany to roll out early and widespread testing, which meant they could catch people with mild to no symptoms and give them care before they got seriously ill. Early testing meant that Germany could prevent people from spreading the disease undetected and lower the spread and mortality rate of the virus. It's important to note that Angela Merkel, Germany's chancellor, is not only a trained scientist, but also a very frank and direct communicator. By early March, she announced to the country that up to 70% of Germans could contract COVID-19 unless they took swift action and unless the German people cooperated with lockdown mandates. As part of a national strategy, the German government had a handful of prominent scientists communicating consistently and honestly with the population. This helped to drown out rumors, conspiracy theories, and misinformation, while also increasing trust from the vast majority of Germans. Another factor that helped Germany's response was their medical capacity. Their number of acute care beds is 2 or 3 times higher than its biggest neighbors. They had so much capacity that they even took patients from Italy, France, and Spain. There is one area, however, where Germany simply got lucky. The average age of Germany's early COVID-19 patients was 49. That's compared to 62.5 in France and 62 in Italy. That meant that by late March, while Spain and Italy were seeing death rates as high as 10%, the death rate in Germany was 0.74%. So, what can we learn from Germany's COVID-19 response? Germany did 4 things really well. 1, they took early and decisive action rooted in science. 2, they built trust with the public by communicating clearly and often. 3, they expanded hospital capacity early. And 4, they provided direct financial support to the public, which made it much easier for people to cope with the stress and uncertainty of a strict lockdown. There's no doubt that these actions saved many tens of thousands of lives. Germany is a great example of what happens when a society fosters trust in science and expertise. Whenever possible, we must work to foster the same kind of trust in science and health experts in our own countries. Peace.